what does it actually mean to be, mentally healthy? It's something I think we all wrestle with, maybe without even putting a name to it sometimes.
It's a really fundamental question, isn't it? And today, we're going to dive into that. We're exploring mental health and mental illness using insights from psychiatric mental health nursing, concepts of care in evidence-based practice.
Right. So the plan is to pull out the key ideas. What is mental well-being, really? How's it different from mental illness?
Yeah.
Because it's definitely more nuanced than just healthy or sick.
Exactly. And how our understanding has shifted over time quite dramatically, actually. Plus, the role culture plays, which is huge.
Yeah, so the mission here is to get a clearer, maybe more sophisticated grip on this whole area. So maybe the best place to start is just definitions. Mental health, mental illness. What's the core difference according to the source?
Okay, so the source puts it quite clearly. Mental health isn't just, not having an illness. It's framed as a state of well-being,
Oh.
where you can realize your own potential, cope with the normal stresses of life, work productively, and contribute to your community. It wraps in emotional, psychological, and social well-being. They're all linked.
So it's active. It's about functioning well, thriving even.
That's a good way to put it, thriving. Now, mental illness, that refers to actual diagnosable mental disorders.
Okay.
These involve significant changes in thinking, mood, or behavior. And the key part is that these changes cause real distress or impair your ability to function day to day. So these are clinical terms, specific criteria involved.
Right, like the difference between feeling a bit down versus having clinical depression.
Precisely. It's that level of impairment and distress, meeting specific diagnostic points.
Okay. And you mentioned our understanding has evolved. I imagine looking back historically, the views were probably pretty different.
Oh, incredibly different, and frankly, quite sobering to look at sometimes. If you go way back to ancient times, there was often this belief that mental illness came from, well, supernatural stuff.
Like spirits or gods being angry.
Yeah, exactly. Demonic possession, divine punishment, things like that. And the treatments reflected those beliefs. Things we'd see as just barbaric now, drilling holes in skulls, trying to exorcise spirits.
Wow. Hard to even picture.
It really is. Then moving into the Middle Ages, you still had some of that, like exorcisms, but also the start of confining people, often in really awful conditions, just walk away.
Still pretty grim.
Yeah.
When did things start to shift towards something more humane?
A big turning point was around the 18th and 19th centuries with what's called the moral treatment movement.
Moral treatment. What did that involve?
It was quite revolutionary, actually. The core idea was advocating for humane care, treating people with dignity, respect, providing purposeful activities. It led to the creation of asylums.
Asylums, which sometimes get a bad rap now, but back then.
Back then, the idea was a huge step forward from just neglect or punishment. It was about providing a place of refuge and care, even if the reality didn't always live up to the ideal, especially later on. But the intent was compassionate.
A recognition of shared humanity, maybe?
I think so, yes. And then the 20th century, that brought massive changes again, Rich.
Absolutely huge. Two major things stand out. Psychotropic medications, starting in the mid-century.
The ability to treat symptoms pharmacologically.
Okay.
Exactly. That was a game changer for many. And then partly because of meds, but also changing social attitudes, you get the deinstitutionalization movement.
Moving people out of those large, often isolated asylums.
Right. The goal was community-based care, integrating people back into society, providing support closer to home. It fundamentally altered the landscape.
Though not without its own problems, I imagine, like ensuring enough community support was actually there.
Definitely. It's a complex history, progress, but also ongoing challenges in implementation.
Yeah, it seems that way. Now, something you touched on earlier, culture. How much does our cultural background shape how we even see mental health or illness?
Immensely. It's a really critical piece of the puzzle. Cultural beliefs, norms, values, they act like a lens. They shape what's considered normal behavior or emotional expression.
So what might seem like a symptom in one culture could be perfectly normal or even expected in another.
Precisely. Think about how grief is expressed or how much emotion is shown publicly.
Hmm.
Big variations across cultures. Or beliefs about the causes of distress, spiritual factors, social harmony, etc.
Which means, for anyone working in mental health, understanding that cultural context is vital.
Absolutely essential.
Hmm.
The term used is cultural competence. It means being aware of these differences, respecting them, and tailoring support appropriately, Without it, you risk misinterpreting things, maybe misdiagnosing, or offering help that just doesn't fit the person's worldview.
That makes so much sense. It adds layers of complexity, but necessary layers.
Hmm.
Now, moving away from the strict healthy versus ill idea, the source talks about a mental health continuum. Can you unpack that a bit?
Yeah, this is a really useful concept. It basically says mental health and illness aren't like light switches on or off. It's more like a spectrum, a sliding scale. So at one end, you've got optimal mental health, feeling good, functioning well, resilient. At the other end, you might have severe symptoms meeting criteria for a disorder, but there's a whole range in between.
Like periods of distress, maybe struggling a bit, but not quite meeting diagnostic criteria.
Exactly. People can be flourishing, struggling, or anywhere along that line. And crucially, you can move along it.
Ah, so it's not static. What makes someone move?
All sorts of things, life stressors, obviously, but also your coping skills, how strong your support system is, your physical health, even societal factors like poverty or discrimination.
So lots of influences, and you can move back towards the healthier end too.
Absolutely. With the right support, coping strategies, maybe treatment if needed, people can and do move towards greater well-being. It's dynamic.
That feels more hopeful somehow, less like a fixed label.
It is. It reflects the reality of human experience much better, I think.
So when we do talk about specific diagnoses, the source mentions the DSM-5. What is that for those of us not in the field?
Right. The DSM-5 Diagnostic and Statistical Manual of Mental Disorders, 5th edition, it's basically the standard classification system used by clinicians, certainly in North America and widely elsewhere.
Like a dictionary of mental disorders?
Sort of, yeah. A guidebook, maybe? It lists all the recognized mental health conditions and provides specific criteria for diagnosing each one.
What kind of criteria?
Things like specific symptoms a person needs to have, how long they've had them, and importantly, whether those symptoms are causing significant distress or problems in their daily life work, relationships, self-care.
So it creates a common language for professionals.
Exactly. It aims for consistency in diagnosis. So if someone gets a diagnosis of, say, major depressive disorder, different clinicians should generally be looking at the same set of criteria.
And how do nurses specifically use it in practice?
Nurses use it as a reference to understand the diagnosis a patient has received. It helps them know what kinds of symptoms to expect, what potential risks might be associated with the condition, and that informs their care planning. How to best communicate, what interventions might be helpful, what to monitor for. It's a tool to guide their understanding and actions.
Makes sense.
Yeah.
Essential for good care.
Yeah.
Now, something that often comes up, and it's a huge issue, is stigma.
Yes. Stigma associated with mental illness is, well, it's a massive barrier.
How does it manifest? What does it actually do?
It shows up in negative attitudes, prejudice, discrimination. People with mental illness might face rejection from friends or family, difficulty getting jobs or housing.
Wow.
They might internalize that shame, feel embarrassed, and crucially, become really reluctant to seek help in the first place because they fear that judgment.
So it isolates people and stops them from getting the support they need. It's a vicious cycle.
It really is. It adds another layer of suffering on top of the illness itself.
So how do we fight it? What's the role of, say, nurses or even just informed individuals in tackling stigma?
It's multifaceted. Education is huge, challenging myths, providing facts about mental illness as a health condition, not a character flaw.
Right, like understanding it's not about pulling yourself together.
Exactly. Advocacy is also key, speaking out against discriminatory practices, supporting better mental health policies. And then there's the personal level.
How so?
Empathy. Listening without judgment, treating people with mental health conditions with the same respect and dignity you'd offer anyone, using person-first language, saying a person with schizophrenia rather than a schizophrenic. Small things like that matter.
They signal respect and see the person beyond the diagnosis.
Precisely. Every interaction is an opportunity to either perpetuate stigma or challenge it.
That's powerful.
Yeah.
Now, thinking about how nurses apply all these concepts we've discussed, the continuum, culture, diagnosis, how does it look in practice? What do they actually do?
Okay, so a big part is assessment. Nurses conduct really thorough mental health assessments. That means evaluating someone's mood, their thinking, behavior, how they're functioning overall. But it also includes looking at risk factors like suicide risk, understanding their cultural background, what they believe about their health, and checking out their support systems. Are they connected? Who helps them? They might also use standardized screening tools.
A really holistic look at the person and their situation.
Yes, definitely. Then comes intervention. Nursing interventions need to be tailored to that specific person based on evidence of what works.
What kind of interventions?
Things like therapeutic communication, really skilled listening and talking, psychoeducation, helping people understand their condition, their medications, coping strategies, collaborating with doctors, therapists, and always ensuring the approach is culturally sensitive.
Right, tying back to that cultural competence piece.
Always. And the third key area is advocacy.
Standing up for the patient.
Exactly. Advocating for their rights, making sure they get the services they need, pushing for better mental health resources in the community or improvements in the healthcare system. It's a really important part of the role.
It sounds incredibly involved and requires a lot of different skills.
It does. It's complex and demanding, but also very rewarding work.
To make this even more concrete, this source material gives a brief case example. Could you walk us through that?
Sure. So the scenario is a 30-year-old person who comes in reporting feeling sad pretty much constantly. They've lost interest in things they used to enjoy, and they're having trouble concentrating, affecting their work.
Okay, classic signs that something's up.
hmm
What's the nursing approach?
First step is always assessment. Dig deeper into those symptoms. When did they start? How severe are they? Crucially, assess for safety any thoughts of self-harm or suicide. That's priority one.
Absolutely. Safety first.
Then, build rapport through therapeutic communication. Listen to their story, validate their feelings, provide psychoeducation, explain what might be going on. Maybe it sounds like depression. Discuss potential treatment options like therapy or medication.
Empowering them with information.
Yes, and collaborate. Talk with other professionals involved, maybe a doctor or therapist, to create a joined-up care plan. Then it's about ongoing support, monitoring their mood, checking if treatments are helping, reinforcing coping skills.
And considering cultural factors throughout.
Always. How might their culture influence how they express distress or what kind of help they're comfortable seeking? That has to be part of the assessment and planning.
It really brings together all the threads we've been discussing.
It does. It shows how those foundational concepts translate into actual care for a real person.
Well, this has been a really insightful journey.
Yes.
If we were to boil it down, what are the main takeaways you think we should leave this deep dive with?
I think, first, the distinction. Mental health as positive well-being, mental illness as diagnosable conditions impacting function. Second, realizing our understanding has evolved dramatically and hopefully continues to.
Hmm.
Third, the huge importance of culture shapes everything. Fourth, the idea of the continuum. It's not black and white, it's fluid.
Right, the sliding scale.
Yeah. Then, understanding the purpose of diagnostic tools like the DSM-5, providing a framework. And finally, acknowledging the reality and harm of stigma and the vital role we all play, especially healthcare professionals, in fighting it through assessment, good intervention, and advocacy.
It really paints a picture that's both complex and deeply human. Understanding these basics really does give you a much richer perspective on, well, being human.
I agree. It's foundational knowledge for anyone interested in well-being, whether their own or others.
So maybe a final thought to leave everyone mulling over. Considering everything we've discussed, especially that idea of the continuum and all the societal influences, where do you think we could make the biggest difference? In terms of societal structures or just everyday practices to really boost collective well-being and chip away at that burden of stigma?
That's a great question to reflect on. How do we build a society that supports mental health across that entire continuum for everyone? Lots to think about there.